Are you guys ready to take notes today? I've been wanting to do a video about this for quite a while, but I know it's kind of a hard one to do a YouTube video about. But today I want to talk to you guys about what are some practical ways that you can help people save money on their prescription drug plans. If you're a Medicare agent, we know that's one of the hot spots. That's one of the pain points. That's one of the main ways we're able to help people. So other than just changing their plan, and there's many ways to help people save on prescriptions, but what are some of the key ways that I've found most effective for you agents out there to help your customers save money on prescriptions, become the hero, and have a lifelong client? Okay, so my name's Kenny Lamons. This is Medicare Millennials, the YouTube channel for Medicare agents. And I'm going to jump right into it, guys, because this might take a little longer than normal. I hope you stick around to the end because every single one of these tips are really useful ways to help your clients gain more business, close more deals, and keep business on the books longer by helping with prescription drug costs. Number one, first and foremost, if you're an agent that only works T65s or only works during AEP and you never work with low-income people, or you haven't familiarized yourself with some of the extra help programs that are available, you're doing yourself a disservice. Even if you don't target the low-income market, I encourage you to become familiar with the super simple program, or at least simple to apply for, that is extra help with prescription drug costs. You do this application through ssa.gov. You don't even have to create a login. So if you're sitting with a customer, you can help walk them through the process of applying for extra help if you and them agree that you think they'll qualify. This is easily done on an iPad or a computer. Not a lot of paperwork, takes just a few minutes. You can do right there with the client. It can help pay for copays or cap copays, eliminate premiums, lower premiums at least, eliminate drug deductibles. It can be worth thousands of dollars a year to your customers. So you truly can be the hero and the savior if you just learn a little bit more about the extra help program and help people apply. Couple of points. If you help somebody get on extra help, number one, they have to have either a Part D drug plan or be on like a Medicare Advantage plan with prescription drug coverage. Okay? So they still need a prescription drug plan if they have extra help from Social Security on their prescription drug costs. Number two, a prescription has to be on formulary with that given plan in order to qualify and you get help paying for it. So in other words, if XYZ drug is not covered at all with a United Healthcare plan, then the extra help program isn't going to fix their problem. It's not going to, it has to be on formulary with whatever plan, whether it's, standalone Part D plan or a Medicare Advantage plan with prescription drug coverage. The drug needs to still be on formulary, okay? Number two, I hope you're taking notes because I don't draw on a marker board like a lot of people do. I should though, I guess. Number two is prescription alternatives. Now, this one's a little weird because we're not doctors. Well, I'm not a doctor. Most agents I know aren't doctors, okay? So we're never given medical advice. However, we always need to be able to educate our customers that every Medicare Advantage prescription drug plan or standalone prescription drug plan offers at least one drug in each drug category, okay? So in other words, even if a certain carrier doesn't offer simvastatin, they're going to offer either a atorvastatin or some other type of statin to help with cholesterol in that category of drug. So you can always educate your client or your prospective client on what the different alternatives to a certain prescription are and the generics, and then ask them to discuss it with their doctor. And then that way, if you're offering a plan that checks all the other boxes, but one of their medicines isn't covered, their doctor may say, hey, no big deal. The plan you want has a atorvastatin on formulary, but not simvastatin. No problem, I can write you a prescription for that. So while you can't change the prescription for a customer, you can educate them that there are alternatives to certain prescriptions they might be able to take advantage of to get all the other things they want on a prescription drug plan or a Medicare Advantage plan with prescription drug coverage. Okay. Number three, different prescription drug plan or a different Medicare Advantage plan with prescription drug coverage. So deductibles, premiums, and the tier that any given drug falls in differ from plan to plan in most cases. And so again, this is great for us. If we meet somebody that's paying way too much on their prescriptions, one thing we can simply do is look at all the other plans that are available in their area as a broker, as an agent, and find a plan that maybe does cover all or most of their drugs and will save them significant money. And then guess what? We've got a new customer at that point. So simply looking at alternative plans that are available to them can save them a lot of money. Number 4, GoodRx and similar programs. So there's a lot of apps and little, some of them you pay for, some of them are free, that are basically discount programs for health insurance benefit for people that get prescription drugs. Okay, so GoodRx is the most popular example. There's other ones out there that you need to familiarize yourself with. Talk to other agents, get on Google, look up these programs, download the apps, so that you could, let's say that there's one prescription that's a booger for a customer, and that prescription is only $10 every month if they use the GoodRx app. They can use that even though they have prescription drug coverage. So they have a Medicare Advantage plan with prescription drug coverage. 6 of their 7 prescriptions are covered affordably under that plan. Okay, let's say you're the agent on that plan. They get introduced to one new prescription and it's not on formulary or it's a high tier. But they go to the GoodRx app or a similar program and they're able to get that prescription just for $5 every time they go in. Problem solved. Okay, so it's really useful, really helpful, doesn't replace drug coverage. Okay, it can be used in conjunction with drug coverage. Number 5, here's a simple one a lot of people don't think about. You have a customer, they call you and tell you that they got a new prescription and it's costing them $16 a month. That carrier may offer 90-day mail order. And a lot of these carriers, if you do 90-day mail order through their mail order program, Tier 1s and 2s may be $0, or if nothing else, it significantly reduces the copay. In a lot of cases, just simply by doing 90-day and or mail order 90-day, okay? So that's a simple one. You've got to familiarize yourself. All carriers are a little bit different on how their mail order works, so whatever your main carriers are in any given area, call the agent services line and familiarize yourself with any options for 90-day supplies or mail order to save your customers money. Finally, number 6, and this one's kind of a last resort because there's not a lot you as the agent can personally do. I don't do this for my customers, but of course will point them in the right direction and educate them that there are manufacturer assistant programs out there, okay, that don't follow the same guidelines that, let's say, Extra Help or Low Income Subsidy does. It's completely contingent and based on that drug manufacturer. And a lot of people that aren't considered low income for Extra Help do qualify for some type of assistance through manufacturers. I'll Google the 1-800 number, I'll Google any forms and try to get them their way, but that's something you can put the ball in their court and tell the customer, hey, here's just an idea, go through the manufacturer. They really might be able to help you out with some of their patient assistant programs, okay? So look, I hope that was helpful for you guys. I know I didn't dive down into each one of those 6 tips, but all of those are things you need to familiarize yourself with. Get a coach, get a mentor, call your carrier reps, and learn more about the 6 ways that I just went over. So here's a recap for anyone that stuck around. Learn about the Extra Help program through Social Security. Learn about suggesting alternative medicines that are in similar drug categories as what they take. Learn the different prescription drug plans and Medicare Advantage plans in your area so that you can always look if another plan will cover that prescription better or have a lower drug deductible or a lower tier. Learn about GoodRx and the other apps that help people save money on prescription drugs. Look into 90-day or 90-day mail order through the different carriers or pharmacies, and educate your customers on manufacturer assistant programs or patient assistant programs through the manufacturer. Hey, let's get a little bit better every day, and by next year this time we'll be a whole lot better. If you guys need help, you're stuck, you need this kind of training, reach out to me and Ethan, MedicareMillennials.com. Thank you.